Greetings, everybody, and welcome to our session today entitled Accountability to Children Through Quality Programming. My name is Kristen Hope. I'm Global Research Advocacy and Participation Advisor with Dar es Salaam Foundation, and it's really my pleasure to be here to facilitate this fantastic session with a wide range of brilliant speakers. So thank you all for joining. I will kick us off just with a little bit of housekeeping. So if it's the first time you're attending the Alliance meetings this year, welcome. If it's not, this will be a bit of a repetition, but we appreciate your attention while we just cover these key points to make sure we all make the most of this space. So the first thing is that we're really pleased to let you know that some of the sessions have a child and youth speaker in them, not particularly this one, but we do have also children and young people in some of the audiences. So we really request that everyone upholds the highest standards of conduct and being sensitive to the needs of our younger participants. All of the under 18-year-olds joining us have been asked to sign a consent form as well with their parents or caregivers, and we have child safeguarding focal points nominated for the meeting. Closed captioning is enabled for all of the sessions. If you would like to use closed captioning, you can navigate to the bottom of your Zoom bar and click the little button that has the letters CC. And then you can also, Zoom provides a transcription in different languages. So if you would like the transcription to be in a different language, please select your language. It's not a full interpretation tool, but it is quite a good way of transcribing the words. But in addition to this, we do have interpretation. So if you navigate to the bottom of your screen, we have interpretation in Arabic. You can click, there's a logo that looks like a globe, and then you will be able to click the language and the channel that you prefer to listen with. We are recording all of the sessions to make them available afterwards, and the sessions are being live streamed on the Alliance channels, including LinkedIn, YouTube, and Facebook. If for whatever reason you are watching through those channels and you can't, you have to, step out, please do know that you'll be able to find the recordings of the sessions afterwards as well. We would be very happy to invite participants to put video cameras on. We really would like to make the most of this space online to make it interactive, to really connect with each other. But we would request that you remain muted, except if you're invited to speak in breakout rooms or in any of the interactive or participatory parts of the segments, in which case you can unmute yourselves. And if you have any technical difficulties, please just message the producer or the host or the co-host in the Zoom chat, and they will do their very best to assist you. Next slide, please. So again, this goes for all of our sessions. We are requesting all participants to uphold a code of engagement, which involves being professional, working together to create a collaborative environment. Really important to respect the confidentiality of different speakers, if that is requested, and particularly actually what's important, we've made sure that if there's case studies being used, that of course these are all anonymized so that there is no identifying information. We really are requesting people to be actively connected, staying present through your device. We know that there's often lots of things happening, with many distractions, many apps and notifications, but we really invite you to be present with us here in this virtual space, to be able to make the most of it, to learn together, and hopefully create new connections that can continue after this meeting finishes. And then so also we invite you to be able to step up and step back, meaning that being aware of the space that we may take, and really being able to open up the space for others who might not usually have the opportunity or the confidence to take part. So really just that mindfulness of engagement. Of course, again, we mentioned, that we really would like this to be as interactive as possible. If you feel comfortable, can turn on your camera. But of course, we know that there's other things happening in the world behind us. So again, let's keeping our microphones muted and being conscious of our surroundings to make sure that they do not negatively impact the environment that we have today. So that's everything from my side in terms of housekeeping. A warm welcome again. And with that, I'm very pleased to introduce our first group of speakers. So our first speakers are with us today. We have Caoimhe Nicabard who's an MHPSS and Child Protection Emergencies Consultant at UNICEF. We have Vanya Alves, who's MHPSS and Education and Emergencies Consultant with UNICEF. And we have Inka Weisbecker, Technical Officer, Department of Mental Health and Substance Abuse from the World Health Organization. They're going to be speaking up to us about effective MHPSS in child protection. How can the MHPSS minimum service package support child protection actors? Over to the three of you. I believe, Vanya, you're kicking us off. Thank you.
Thank you so much. So I will dive right into the presentation about the mental health and psychosocial support minimum service package. So moving on to the next slide. The minimum service package, or MSP for short, was developed in the context of growing interest in mental health and psychosocial support, MHPSS. So in recent years, there has been a big increase in the number of MHPSS activities being implemented in emergencies, and also the variety of different types of activities implemented. We're seeing MHPSS being integrated into many different sectors and areas of work, including child protection, GBV, health, education, nutrition, etc. And globally, there has been more recognition of the importance of responding to mental health as well as physical health needs. And there has been more political will and donor support. Along with this increased interest, there have been many high-level meetings and reviews of MHPSS in humanitarian response. And something that came up again and again in these discussions is that while this growth in MHPSS activities has been really important, there is still a lot of variation in what MHPSS activities look like and how they are understood. So existing guidance does provide a good starting point, but implementing agencies say that they need more information on how to choose between different activities to make sure their work is impactful and of high quality. And from a funding perspective, donor organizations were saying that in order to more effectively fund MHPSS, they need more information on what the priority non-negotiable activities should be and how much funding they need to dedicate to these priority activities. So we are now going to show you a brief video to give you some background on the purpose of the MSP.
The number of people affected by humanitarian crises is at a record high. Armed conflicts, natural disasters, and public health emergencies like COVID-19 cause widespread suffering and seriously affect people's mental health and psychosocial well-being. Many people affected lose everything they care about: their loved ones, homes and livelihoods, their communities, their sense of place and sense of self. Yet resources for mental health and psychosocial support services are severely lacking. This leaves many people in severe distress and without the care they need. More than 85% of people affected by mental health conditions in humanitarian settings do not receive treatment. Where services do exist, they are often disconnected and inconsistent. Service providers often lack the training and support they need to provide safe and effective services. Humanitarian donors often don't know which MHPSS activities they should fund, and those planning and implementing programs are faced with tough decisions about what to prioritize. The MHPSS Minimum Service Package outlines the minimum MHPSS activities that should be implemented in all emergency settings across health, protection, education, as well as a range of other sectors that contribute directly and indirectly to MHPSS outcomes. The package is based on existing guidelines and extensive consultations with people involved in humanitarian assistance in frontline, regional, and global roles. It is designed to support humanitarian actors too. Improve coordination between different sectors, identify MHPSS program gaps and priorities, provide timely MHPSS programs based on evidence and guidelines, increase funding allocation for MHPSS, improve coverage of MHPSS activities, and ultimately, improve the mental health and psychosocial well-being of people affected by humanitarian crises. With the collaboration from humanitarian actors around the world, the MSP can play a key role in helping people to recover and rebuild their lives after an emergency.
Great, thank you. So what does the minimum service package looks like? It is a set of MHPSS activities that are considered to be of the highest priority in meeting MHPSS needs in an emergency. The package is based on available evidence, best practice guidelines, and expert consensus. So the idea is that when an emergency happens, we don't need to start from scratch. We already have quite a lot of knowledge and evidence from emergencies around the world to help us in prioritizing what we do. It is intersectoral. It incorporates activities that are typically delivered by child protection, health actors, education, and other sectors and AORs. And by combining this wide range of different types of activities into a single framework, it can help create a shared understanding and a common language when it comes to planning and implementing an MHPSS response. Now, in terms of what it looks like, the MSP is available in two formats, as a printable PDF and as an interactive web platform at mhpssmsp.org, as you can see on the slide. The ISC version is available in English. We are now updating the Spanish, Ukrainian, French, and Arabic versions. Now, the web platform has a lot more features. For example, you can filter the activities by sector, and you can access orientation videos and other useful resources. I'll now hand it over to Quiva to tell you about the structure and the content of the package.
Thanks, Vanya. So, the minimum service package activities are organized into 4 sections. Section 1 focuses on interagency coordination and assessment. Section 2 lists essential components of all MHPSS programs. So this includes things like developing systems for staff well-being and supervision, and systems for monitoring and evaluation. So activities that are maybe more internal looking to look at your processes within your organization if you are delivering MHPSS activities. Section 3 then contains the programmatic activities, and this is the bulk of the minimum service package. It covers everything from community-wide messaging on common stress reactions in children of different ages, for example, to activities like orienting frontline workers on basic psychosocial support skills, structured group activities for children, and right the way up to focused support, like providing MHPSS through protection case management and psychological interventions for specific mental health conditions. Finally, Section 4 contains activities focused on very specific settings, so things like infectious disease outbreaks. And an important point is that no single organization is expected to implement the entire MSP. So it's really a framework for the whole response. So different organizations must coordinate and work together across different sectors and areas of responsibility to ensure that the minimum package is implemented across the response by all the different actors working together. So on this slide, we have just zoomed in on some of the programmatic activities. So you can browse the MSP in detail to look at all of the activities yourself, using the web platform or the PDF. But just to give you a sense of how it's organized, Here you can see that each activity is tagged with coloured icons that represent different sectors or areas of responsibility. So, for example, child protection, health, education, shelter, and so on. So the colourful icons indicate sectors or areas of work that are typically well placed to actually implement or deliver that activity. So you can see the child protection icon is this green icon with the big hand holding the little hand. And you can see that for the activities on the screen here, along with some other sectors, child protection is listed as being typically well placed to deliver the first two activities here. So 3.6, which is provide group activities for children's mental health and psychosocial well-being. So these are structured group activities often delivered in child-friendly spaces by child protection actors. You also see the little book icon there, which indicates that education actors also often deliver these activities within education settings. The second one then is promote caregivers' mental health and psychosocial well-being and strengthen their capacities to support their children. So that's another one that's typically delivered by child protection. You can see that the third activity here, provide mental health care as part of general health services, is generally led by health sector, so health actors. So their health is represented by this light blue icon. And then as well as the coloured icons, on the right, we have some dark blue icons. And these indicate sectors or areas of responsibility that have a role to play in supporting the activity, though they might not be the ones leading on the activity. So for example, 3.6, child protection actors might deliver group activities for child well-being, but camp coordination and camp management actors might facilitate this by providing space and notifying the community about the activity and that sort of thing. So you can see that the symbol for camp coordination and camp management is in blue on the right, whereas the child protection logo is in green on the left. And similarly, looking at the last activity again, like I said, health actors are typically the ones who lead on integrating MHPSS into health services, but child protection actors might play an important role, for example, in reaching children that are hard to reach and might need mental health services. So in this case, health is in colour as the lead and child protection is in dark blue as a potential supporting sector. So those are just some examples to show you how it works. But again, you can browse all the activities on the platform. So every single one of the MSP activities comes with a brief introduction explaining why the activity is important, a checklist of actions to help plan and implement the activity safely and effectively, additional actions for consideration. So these are activities that might not be considered minimum in all contexts, but you might want to prioritize them based on the needs and resources in your particular context. And finally, a list of key guidelines, standards, and tools that are relevant to implementing the activity, and links to all those tools in different languages where they're available. So now I'm going to show you a quick video tour of the web platform to give you a sense of where you can find all these different components when you explore the platform yourself. Okay, it looks like we're having some trouble showing that video. So we might move on and we can come back to this if we have time at the end. I can open it in another browser. So for now, we will, oh, maybe I can't even move my slides. Here we go. So now I'll move on to just recapping who the MSP is actually for. So the MSP should be useful to a wide range of actors. So that includes people planning and designing MHPSS strategies and programs, whether that's as part of an actual response or indeed as part of preparedness for humanitarian emergencies. It's also useful for coordinators, so particularly the MHPSS technical working group coordinators, but also it's very relevant to child protection coordinators, education coordinators, and anyone else really who wants to know more about how MHPSS fits within the wider humanitarian response. It's also relevant to implementing partners and technical advisors. So the MSP is designed to help you plan and budget and implement MHPSS activities effectively. And finally, donors. Actually, donors were one of the key groups that actually were asking for something like the MSP because they wanted something to help them make good funding decisions that are informed by evidence and best practice guidelines. So just to summarize then, how can the MSP help child protection? Well, really, the MSP aims to provide clarity around what counts as MHPSS and what it typically looks like in different sectors, including in child protection. So by providing a kind of a common language and a common set of activities, it can help us to coordinate and collaborate across agencies and across sectors to identify and address gaps, to advocate to donors and to others about MHPSS needs and activities. So it's a good document for advocacy in that you can say to a donor, look, this activity has been recognised as a minimum in the response, and we need your support in implementing it and addressing gaps. It can also help with planning and decision making. There are practical checklists that help you identify the different actions you need to take to implement an activity. Overall, it helps you identify what to prioritise and to estimate costs and develop budgets. Both as individual agencies, but also, if you're involved in helping to write a humanitarian response plan or a refugee response plan, the MSP makes it very easy to include appropriate MHPSS activities in the sections for different sectors. So you can simply pull the relevant activities from the MSP, knowing that that language and terminology has all been through an extensive review process and has been negotiated already across different sectors. The MSP can help with implementation by helping you to see who is well placed to implement each activity, but also linking you with relevant guidelines on how to implement each activity, and also guidance on working with specific groups that might have particular needs, like children associated with armed forces and armed groups, unaccompanied and separated children, children with disabilities, etc. So the existing resources have been pooled together for each of these groups on the MSP platform, and you can follow through depending on any specific groups that you're working with. So just before I wrap up, I'm just going to hand over to Vanya to just tell you a little bit about our next steps for the MSP. Over to you, Vanya.
Thank you. I was just having some trouble unmuting. So in terms of next steps for the minimum service package, we are now updating the website and we are translating the package. As mentioned before, working on the Spanish, French, Arabic and Ukrainian versions of the ISC MSP. We are going to carry on with orientations and events on disseminating the MSP and working with colleagues to make them more comfortable to use the MSP to strengthen the MHPSS response wherever they are. We are also developing key materials and tools where gaps have been identified. So this has been a long process. We are now in the 4th year working on the MSP, and throughout that process, numerous consultations have led to findings in terms of key gaps in materials and tools that are needed to facilitate the MHPSS response. And we are also providing technical support for country-level use of the MSP to strengthen the MHPSS response. So please feel free to reach out if you need support using the MSP in your response. You will see our contact details on the screen in a bit. And I will now hand it over to Quiva just before we wrap up to see if we can watch the video on the website, MSP website video tour.
The MSP platform is available at mhpssmsp.org. You can use the buttons on the top right corner of the page to choose between different languages. The platform has 5 main sections: the Home tab, the MSP Guide tab, the All Activities tab, the Gap Analysis tool, and Downloads. The Home tab provides a brief overview of the MSP. The MSP Guide provides a more detailed introduction, explaining what the MSP is, why it's needed, how it can be used, and how it was developed. The guide also includes a section on general principles and considerations that are critical to the safe and effective implementation of MHPSS activities. The All Activities tab lists the MSP activities. From here, you can click on any activity to access a brief introduction to the activity, a checklist of core actions, additional actions for consideration, and a list of relevant guidelines, standards, and tools. Some activities contain additional information, such as key considerations specific to the activity, and lists of recommended training topics for staff implementing the activity. You can also filter the activities by sector or area of work, and search for key terms using the search bar. The Gap Analysis tool allows users to log in and use an interactive survey to map current MHPSS activities and help identify gaps and priorities. The Downloads section allows you to download shorter PDF versions of the IASC MSP in different languages, along with other useful documents such as a step-by-step guide for different users and a summary of frequently asked questions and answers. The MSP web platform is hosted by the Mental Health Innovation Network.
So there you go. That's all from us. I'll put our contact details back on the screen.
Can Ariel take on the wash cold challenge? Tough stains like mud and sweat are harder to remove in a cold wash. Ariel pods are rated best.
Yeah, so there we go. I don't know if we have time for questions now, Christian, or if we need to move on to the next presentation.
Thank you so much for that presentation. We have about 3 minutes left, and thanks to Ariel Washing Powder for getting some free advertising on our channel. But yeah, so if there's a burning question, we can certainly take one from the audience. If anyone would like to use the chat, or feel free to unmute yourself if one of the speakers in the audience would like to ask a question to the panelists.
And if not, you can always get in touch with us using our email addresses that are on the screen. I can pop them into the chat so they're easier to copy and paste as well.
Perfect. I don't see anyone with any burning questions, but I can see a lot of appreciation coming through in the chat. And so please may I echo that by thanking the three of you, Vanya, Krifa, and Inka, for this presentation. And maybe also, we do have a question. Can this tool be used by local organizations? There we go.
Sorry, Vanya, you might be muted. No, or will I go ahead? Yeah, so the answer is yes, absolutely. We hope that local organizations will find it useful. It was piloted, well, it's been piloted in many countries, but we had an intensive piloting period where we had a year of piloting of specific MSP activities with actors in Iraq, in Colombia, Nigeria, South Sudan, and Ukraine. And we had many local organizations and local actors involved there, both talking about kind of community-led NGOs, women-led grassroots NGOs, but also local governments were involved in the Nigeria pilot. So we hope it's useful to everybody. We know that for organizations that maybe aren't used to working in humanitarian outbreaks specifically, they can find some of the language around humanitarian architecture unfamiliar. So, you know, we're here to support for anyone that is maybe not used to working in a humanitarian emergency. But yes, it's for everybody. And thanks, great question.
Thank you so much. We do have another question that's come through. We probably don't have time to address it right now. So I'd really invite our colleague who's put that in the chat to maybe reach out to Quifa or Vanya or Inka to ask that question and maybe have a further follow-up conversation about that important question around the gaps. So thank you so much. Thank you to our audience participants for following so closely. I would also like to take this opportunity to just react by saying that I found it very timely as well. And when you were presenting, Quifa, and there was that diagram as well, where you're looking at all of the different humanitarian sectors and the way in which this sort of tool can be influential across humanitarian sectors. I take this opportunity to share, of course, the graphic and the narrative that was launched on Monday in the opening plenary of the Alliance annual meeting on the centrality of children and their protection in humanitarian action. So again, this idea that it's the responsibility of all humanitarian actors across all different sectors to be accountable to children, to be protecting children, etc. So I think this is, is squarely in line with this, which is the overarching topic of the meeting this year. So thank you so much to our panelists. And with this now, we will pivot onto our next segment, which is also staying on the topic of mental health and psychosocial support, MHPSS. I'm very pleased to welcome a group who will be speaking about the EQUIP methodology. So I'm very pleased to welcome Fiamma Rupp, who is MHPSS specialist in child protection humanitarian action and the EQUIP help desk lead at UNICEF New York. I'm also very pleased to welcome Margaret Atieno, who's a psychologist with PDO Kenya, Kennedy Ikwe, who's MHPSS officer for IOM in Kosovo. We also have Celestine Ame, who's also an MHPSS project assistant at IOM, but in Nigeria. And we have Eliane Nakour, who's PSS technical officer for War Child in Lebanon. The floor is yours. Fiamma, I think you'll start us off.
Thank you so much. Welcome, everyone. And I'm so pleased to see so many people here. We're very excited to present EQUIP, but trying to engage all of you a little bit at the beginning. So here I'm sharing with you the website, just if you want to check it out, not now, but maybe later. So we are wondering at the beginning, how do you measure competence and quality in service delivery to children and their caregivers by your non-specialist staff? Are there any challenges? So feel free to write anything in the chat. If you hear, I'm putting our first question in here. In your work, when you work with children, that doesn't have to be possibly just child protection, but maybe you work on GBV or health or MHPSS or education or anything else related. EQUIP is really cross-sectoral and looking at the competence that non-specialist staff have when they do service delivery. So if you think about how do you measure the competence and the quality in service delivery, you can, okay, now it's also shared in the chat. We have a Jamboard as well. So if you click on the Jamboard, perfect, you can start to add anything, any thought. And we have just a couple of minutes for that. It's like really just brainstorming, not anything, sophisticated thought through for like 3 hours, but really just to come up with some thoughts around that first question. We want to get your brain juices going. So in case you you have not worked with that before, on the left you have little sticky notes. So you can click on it and then you can put your answer in it, and then it will just show on the Jamboard that we have shown here. So feel free to add your thoughts to the question that I also popped into the chat. Oh, I can see we started using WeAct, which is wonderful. So that's great. Okay, and then others are saying, I do not have experience doing that, only doing competency checklists for CFS and case management and staff during recruitment and early onboarding. That's wonderful. Okay, and when the beneficiaries provide positive feedback of the interventions they receive, okay, great. Then there is something in Arabic, which unfortunately I do not speak. I wonder if maybe
it says that
again,
it's through, it is through interviews and other tools and assessments.
Wonderful. So I can see that actually a lot of you are already, of course, measuring competence in service delivery. Anyone else wants to come in? Otherwise, this is a great start. And what are challenges maybe? Now you have said how you measure it. Anyone has any challenges that you want to share when you measure competency or quality service delivery to children and their caregivers? Any challenges that you have done? So here translate, questionnaires and interviews, thank you, what Eliane said. Then UNHCR does some training for non-specialized staff, like refugee registration staff, okay, through satisfactory surveys, okay. Okay, others say that they haven't actually done this yet, so maybe the challenge is, as you said, you don't know what to do and how to even get started. I hope that EQUIP would be a wonderful start with that. Then we have another colleague, Eliane. Do you want to support?
Okay, so the actual Arabic one is knowing, okay, it's a bit small, okay. So knowing the impact of the program on the kids and on the children, and okay, and how children can accept and can welcome these kind of programs.
Mm-hmm. Okay, wonderful. Okay, then we have another one, challenge high turnover of staff and not staying long in the project. Mm-hmm. Meeting with beneficiaries at the end of the service delivery. Direct monitoring of activities and the extent of children's interactions. And client feedback, focus group discussions, donor partner project monitoring. And then also another challenge is when non-specialist staff have so many other responsibilities. That is very true. They may be able and willing, but not have the time, human resources to undertake efforts like this. Yes, wonderful. Yeah, there are so many challenges. So thank you so much for sharing those with us. We will move on and try to see what EQUIP can do to answer this question as well. So can we go and move forward to the presentation, please?
Globally, close to 1 billion people are living with a mental health condition. In emergency contexts, the needs may be even greater, with 1 in 5 people exposed to war or political violence likely to experience a mental health condition. Yet most people around the world do not have access to adequate mental health care. Fortunately, evidence-based and effective mental health and psychosocial interventions are available that can help treat and prevent many mental health conditions, including in low and middle-income countries. These can be delivered successfully by people who have received training and supervision but are not mental health specialists. Ensuring high-quality and effective training and supervision is key to the safe delivery of these interventions. This is why the World Health Organization and UNICEF developed EQUIP. EQUIP stands for Ensuring Quality in Psychological Support. EQUIP is a freely available resource to guide trainers and supervisors on how to change their existing programs into competency-based approaches. A competency-based approach means that helpers not only have the knowledge, but also the skills needed to deliver quality services. EQUIP can be used alongside any type of mental health training or supervision and supports the use of role plays and real-world assessment of helpers. EQUIP offers a range of tools to assess different types of competencies. This includes tools for working with adults, children, adolescents, and groups, as well as specific skills for psychological interventions. EQUIP makes it easy to track changes in skills during and after training. After evaluating trainees on each skill, the platform automatically displays feedback to identify strengths and any potentially unhelpful behaviors for which further training is required. Research conducted on EQUIP showed that when compared to standard training approaches, trainees in EQUIP-based programs were more likely to reduce harmful behaviors and strengthen helping skills. For example, use of EQUIP in Lebanon with children and adolescents led to an increase in mastery of core helping skills compared to standard training approaches. Trainings in Peru and other countries have shown similar benefits. How can you get started using EQUIP today? Register online to receive assessment tools, resources for adapting training and supervision, and easy-to-use visual summaries for competency-based feedback, all free of charge. EQUIP will enhance your trainings and supervision and help you and your team to build safe, effective, and high-quality services. Get started today at equipcompetency.org.
Thank you very much. Can we go to the next slide, please? Yes, next slide, please. Next slide. So, EQUIP, you might wonder, what does it stand for? So EQUIP stands for Ensuring Quality in Psychological Support. And EQUIP really enhances training and supervision and on-site monitoring for improved mental health and psychosocial support, and also effective and safe delivery of services. So it's really cross-sectoral. What you see here right now is a screenshot of our platform. And here we have three main areas, which are the How to Use tab, where you get e-learning on how to use EQUIP. You can do this all without any support from our team or the help desk. Here you have the face of the help desk, myself. And you can just go through e-learning courses that will take you through step-by-step how to use EQUIP in a very easy way. Then you have resources. There you have all accompanying documents and resources that you need to or can use to support your integration of EQUIP in your trainings or your programming. And then you have competency assessment tools, where you can find all the different tools to assess the competency of your staff, non-specialist helpers, how we call them. And then we like, if you wonder why is there a need for safe and effective psychological support, and that's kind of more evident than ever with, you know, most people with mental health conditions around the world not receiving effective care. And among people living with depression, only 1 in 5 people in higher income countries and 1 in 27 in lower middle income countries receive minimally adequate treatment, and in part due to an insufficient number of workers well trained in mental health care, or specialists, as we know them. And one way to address access to care is to expand the psychological and psychosocial support services delivered by diverse cadres in different settings. As we know, through task shifting as well, with supervision, but non-specialist staff. And with appropriate training and supervision, professionals and non-professionals can provide support and effective help. And so the value of EQUIP is that it helps with the assessment and building of the skills we can observe. So specifically, these are those observable skills, such as active listening or building rapport, communication, empathy, and so on, that helpers need to master for the delivery of any MHPSS support, or also any other cross-sectoral service where those foundational helping skills are necessary. Next slide, please. Yeah, you can go exactly. So what is EQUIP? EQUIP, as I said, is the ensuring quality and psychological support, but also cross-sectoral programming. It's a collaboration between UNICEF and WHO, as we heard, and it's a platform that makes, as I said already, kind of freely available a workforce package for online and offline use to support NGOs or UN agencies or governments or academic institutions, really anyone that works in both humanitarian and development settings, in training and supervising your workforce, but also monitoring on-site your staff in communities or wherever you work. And then the goal of EQUIP is really to improve the quality of mental health and psychosocial helping skills for safe and effective services to adults and children. And the assessment tools and resources can be used in existing or new trainings. There is no modification needed, just an integration of those foundational helping skills. They can be used in supervision programs and also on the go for site observations. And you can use it on the laptop, on a tablet, but also on mobile phones. And as I said before, you can use it when you have internet access, but also when you don't, because it will automatically sync when you're back to internet. So you can also use it offline while you're assessing the competencies of your staff. And that's for trainers, supervisors, program managers, and any other staff across the sectors. And the goal is also really to provide resources, the tools and the guidance for the assessment and the improvement of those foundational competencies to ensure that people being trained to deliver across sectoral services and mental health and psychosocial support achieve those skills needed for safe and effective care. Okay, next slide, please. Okay, just to look at some facts, it's funded by USAID. It's for the past 5 years. It's really great because we have such strong evidence that working with EQUIP has a benefit to train and have reach higher quality for your non-specialist staff. And I think we can even proudly say that even specialists are starting to use EQUIP as well. So it was intended for non-specialist helpers, but even specialists are using this now to see and to assess a quality competence of their staff, professionals and non-professionals. And it's really showing these improved competencies and the reduced potentially harmful behaviors among trainees or your staff when they are trained using the EQUIP approach. We have a help desk, as I said already, that's myself. And we support through the help desk organizations to integrate EQUIP in your trainings, in your supervision, in your programming. And yeah, as I said, for training, supervision, visit observations, pre-service training, and also to look at your competency frameworks. We have a community of practice. We have webinars where we showcase organizations having used EQUIP, and we have had really significant uptake in the field. We had over 10,000 registered users and in the use in more than 100 countries. Yeah. Next slide, please. Just to let you know, the evidence base for EQUIP for the development has started many years ago, actually 5 years ago, and for 3 years it was really tested, adapted, changed, and modified. It started in 8 countries, but then with the uptake, there was more field testing, and it was really done, like the development of the competencies were through 18 psychological interventions that were also evidence-based from all over the world. And so those foundational helping skills that you have in the different tools will then be, are then represented from not only field practice, but also from those evidence-based manuals. Yes, next slide, please. So just to finalize before we go into our panel discussion. So we have 12 assessment tools. One is currently being field tested. So we have the 3 main foundational helping tools. And those are ENACT, those are foundational helping skills working with adults. Then WeAct, the foundational helping skills working with children and adolescents, and GroupAct, which are competencies where you can assess the foundational helping skills working with groups, both with children and with adults. Then we have intervention competencies, PM+, Thinking Healthy, and now MHGAP. And then we also have treatment-specific skills, behavioral activation, cognitive, interpersonal, motivational enhancement, problem solving, stress management, and relaxation skills. But we say that whatever you do, even if you do a PM+ intervention or you do any other intervention or program, the most important thing is think about, are you working with adults? Then you would use the ENACT, those foundational helping skills. Are you working with children? Then you would use the assessment tool for WeAct. Or are you working with groups? And then you can use GroupAct. But you can also mix and match different tools so that you can have your tailored and bespoke assessment for what you need in your programs. And also just to say that, again, I've not trained, and our team has not only trained MHPSS staff, non-specialists or specialists, but also in child protection, education, health, MHPSS I already said, but even nutrition and logistics. So really, it's all about cross-sectoral assessment. Okay, this took a bit longer than we thought. Let's go into our panel discussion then, and just we have some interesting facts that we want to share with you. So asking our teams in the different countries. So we have Margaret, who is in Kenya. We have Elian, who's in Lebanon. We have Kennedy, who was in Nigeria. So he will share his Nigeria experience. And I think Ame couldn't make it. But so we have those 3 country contexts. So I would like to start to ask, what was your training about for which you used Equip? And yeah. So do we want to start with Elian maybe?
Yes. Hello, everyone. So this is Elian from War Child Lebanon. So basically, we started piloting Equip in our supervision and our observation and mentoring and coaching for the facilitators who are in contact directly with children or caregivers. And lately, we have been training all the staff from the technical unit, because we mentioned it's cross-sectoral, so from the child protection team, education team, and psychosocial support team, to use the WeAct and the ENACT tools in mentoring and coaching and the on-site observations on field.
Thank you. Kennedy?
For us in IOM implements, provide direct MHPSS services for affected population. In Nigeria, we have a wide range of people who are affected by the conflict, and IOM's model of providing psychosocial support is through a multidisciplinary team called the Psychosocial Mobile Team. So you see the team have different backgrounds, different experiences, different competencies. So usually we bring them together. We conduct trainings for them to ensure that we harmonize IOM's response, IOM's MHPSS response for those who are needing MHPSS services. So Equip, at one point when we had to do a refresher training, we encountered Equip, and we saw that Equip was just addressing most of the competencies that the teams have been, most of the competencies which the team has have highlighted as challenges while providing direct service provision, because like I said, it's a multidisciplinary team. Not all psychologists. Some are social workers. Some are community health workers. some are educationists and the likes of them. So that is why we used Equip during one of the refresher training for the MHPSS service providers for IOM.
Thank you very much. Thank you. Margaret?
Hi everyone. For us, we used Equip with our team of mental health champions. We consider them also our lay counselors in the community. So we used Equip to train them on providing mental health and psychosocial support services in the community. So ideally, that is what we used Equip for. Yeah.
Thank you, Maggie. And can I ask you, we'll just go back like this. What has been different between doing training as usual without Equip and a training where you integrated Equip? And also if you could just add, what were the main challenges, but what were also the biggest success to actually having used Equip?
Okay, I'll go ahead. So back to our context, we are using Equip in our observation and mentoring process. So if you want to highlight a bit like the difference. So with the use of Equip, we noticed that we are reducing more the harmful behaviors and enhancing the effective ones because the tools offer very specific behaviors that we look for in the sessions. That's one. On another hand, the tool itself, the platform itself, gives us a standardized and structured process to elaborate on our mentoring process. So every staff from the 3 technical units, child protection, education, and psychosocial support is using a standardized tool, a standardized method, and to enhance our competency building with the facilitators as well. So those are the 2 major differences. As for the challenges, one of the challenges that we face by using the Equip platform is that the tools in the Equip platform usually offer very specific competencies that we look for in the sessions. But in addition to that, sometimes we need to find we need to look for other competencies during our sessions that are related to for each curriculum. So we added other tools to let's say to accompany like the Equip platform in our field visits and our monitoring process. One of the biggest success, lastly, is that Equip platform encourages every staff to hold accountable and to look for quality work. So with the use of Equip, we are encouraging everyone to look for the quality before the quantity and to hold more accountable. Thank you.
Thank you. Then Maggie, maybe, and after that, Kennedy. Yeah, Maggie?
I'm going to have to ask you, Fiamma, to wrap up, please. Thank you so much.
Yeah, if you can just like in 1 or 2 sentences, the 2, if they can answer, and then we will wrap up.
The difference came in because initially when we were training our mental health champions, we used to focus on the theory part, but Equipped allowed us to bring in a more practical way. So there was a combination of theory and practical. So the combination allowed our sessions to be more interactive and our team of mental health champions to understand more what we are training them on. A challenge that we faced was the role plays. At first, people find it hard to automatically do the role play, which we decided to incorporate into bits and bits of our training. So if we're teaching them on empathy, we allow them to do a short role play so that they can understand what empathy is. And then eventually they do the long role play. So this was how we managed to push through and overcome the challenge. Yeah.
Thank you. And Kennedy, just 1 sentence so that we can wrap it up. You're muted, sorry.
Yeah, so just in 1 sentence, the use of Equip made our work, our service provision in Nigeria very practicable. Every staff who was provided MHPSS service could easily see on the dashboard what their strengths are, what their weaknesses are, and through a mentorship program, because Equip has different, you have different entries. You could support your staff or you could support your team to know at different moments where their strengths are, how they are growing or how they are improving on their competencies. So for me, it's very practical. It's easy to record. It's easy to go back and reference from where you started and how far you've come. So it's a good one for mentorship and coaching of any MHPSS or any helping professional. And that will be all from my side.
Thank you so much. Okay, back to Kristen. I saw that there are a lot of questions, and we might want to maybe answer them in the chat as well. Yeah, is that okay?
That's a fantastic suggestion, Fiamma. Thank you so much. And thanks to everyone on that panel. It's so important, so rich really to listen to the experiences of you all as professionals in different contexts. So thank you so much. We're running a few minutes behind schedule, but I think we'll be all right. And so with this, I would like to pivot onto our third and final segment today. So we're moving on slightly from the topic of MHPSS, which we've heard now from two different panels who've been speaking to that from different angles and different tools and resources. And now we're going to be hearing about key interagency tools and guidance for improved data protection and information sharing in child protection case management and best interest procedures. So this will be, we will welcome Jessica Stewart, who is the Child Protection Officer for UNHCR headquarters, and Laurent Chapuis, who's Senior Child Protection Specialist at UNICEF. We're so pleased to have you both. The floor is yours.
Thank you very much, Kristen. I will start and then I will hand over to my colleague Jessica. Indeed, you said it, we are going to look at accountability to children from a slightly different angle, from a case management, best interest procedure, and information management perspective. We can go to the next slide already. Not only because we believe that this makes case management and best interest procedures more effective, but also that because we are accountable to the children and their families, given the data we collect on their situations, on the issues they face, and on their situation. So the idea today is indeed to present agency efforts, but more importantly, products that have been developed on data protection and information sharing, developed by UNHCR and UNICEF on behalf of the Alliance Case Management Task Force. We will go through some of the reasons, some of the rationale as to why it was felt those products, this guidance was needed. Jessica will explain how we went through field consultations and lesson learned exercises through the support that was provided to a number of countries with respect to those issues. And more importantly, we hope that practitioners that have joined us today will leave the session a bit more familiar with some of those key products, tools, processes that will have been presented. Next slide, please. So in terms of context, basically what triggered this work was the observation that there was a lack of clarity, a number of gaps as to how that type of child protection data on highly sensitive issues in highly complex environment should be dealt with, handled, and shared amongst organizations. We also had to acknowledge as a sector that not all child protection practitioners are expert lawyers or have a lot of familiarity with data protection, data management principles. So there we observed a number of gaps, a number of challenges, which were in the way of good collaboration, effective management of this data. The idea being that at the end of the day, we want to reach a situation where everyone, all organizations, are able to handle in a safe and ethical way the data they collect on those children's situation. This is how the need for guidance, tools, training was identified. And this work is very much the result of an ongoing commitment from a number of actors, including UNHCR and UNICEF, initially under the blueprint, now under this strategic collaboration framework that was developed between the two agencies in very close collaboration on behalf of the Alliance Case Management Task Force. On that note, I'm going to hand over to Jessica for the next element of the presentation. Jessica, over to you.
Thank you so much, Noran. So I'm going to take us through 3 of the products that we have been developing over the last, I would say, 2 years, working very, very closely as UNHCR and UNICEF under the Alliance Case Management Task Force within a working group called the Information Management for Case Management Activity Group. So UNHCR and UNICEF are operating as members of the Alliance Case Management Task Force. These were not bilateral UN efforts, but rather a large group of NGOs, UN agencies, and experts in law, in data protection, case management specialists, and so on, really coming together and digging in. We have a running joke that as child protection specialists, we should get an honorary law degree after going through all these data protection and information sharing regulations and frameworks. So what I want to talk to you first about is our guidance note, and it has a very long title. But the title it really tells you a bit about what we were trying to achieve, and that is to develop and define processes of how information management for case management, and specifically data protection and information sharing, can be clarified at the field level. Who's responsible? Who is this for? What does it include? What are the tools that we use? So the title of this note that is forthcoming is the Guidance Note on Data Protection and Information Sharing in Child Protection, Case Management, and Best Interest Procedure in Humanitarian Settings, including refugee settings. You may be wondering why such a long and perhaps verbose title, but this really is because we've been developing tools together that are not just for conflict emergencies, are not just for refugee settings, but can actually be utilized in all types of humanitarian settings, and therefore just have specific sections dedicated to refugee specificities, such as UNHCR's Best Interest Procedure. So in all of these tools, we really are ensuring that they can be used across different settings. And I think that is one of the strengths that they have. So this guidance note was born from concerns that were emerging from field practitioners, particularly since 2018 and as well during COVID-19. And this was rather focused on how are we managing all the data that we are collecting, storing, sharing, processing, analyzing in the implementation of child protection case management and BIP, Best Interest Procedure for refugee and asylum seeking children. So this also rose concerns on what about information sharing to and from UNHCR in refugee and mixed settings, between different humanitarian actors, with governments or national authorities responsible for children and families. And it also came to looking at the use of different digital information management systems. For example, 2 of the biggest tools that we have globally in humanitarian settings are UNHCR's Progress and Primero's CPIMS Plus, the Child Protection Information Management System. So there was also a need for clarity around how those systems can communicate with each other. What we did is we did a ton of global consultations. We defined an outline within the CPIMS Plus steering committee, and then later took this under the case management task force. We had a series of in-depth remote country consultations where we spoke to our field colleagues at different levels, those that were caseworkers, case managers, coordinators in varying coordination forums, as well as UNHCR, UNICEF, IOM, and others, and spoke about what did we really need to provide guidance on. And this is where we learned that the issue was not so much about what system are you using or what forms are you using, but rather about clarity on which tools you use to govern the process, who is responsible, and what are the practices the principles in practice for data protection and information sharing. So this is really what this guidance note lays out, and it includes 2 tools that we have developed: a global standard interagency data protection and information sharing protocol template. Again, we love a long title. And the next is a data protection impact assessment. And I will talk to you about the DPISP, the short name. If you can move to the next slide, please. So these are 2 tools that we have developed, again, under this global case management task force and the information management for case management workstream, involving so many of the NGOs. And I see many of the colleagues are here today. So I hope that you are also cheering that these products are coming to be out in the wild. So with the DPISP, this is an information sharing protocol, and one of our legal colleagues defined it for us like a list of club rules that all the members of the club sign up to the club rules on how we share information, what we do and what we don't do. And we find that a really useful explanation or analogy for what the tool is. Ultimately, we found that in the wild, all over the world, there were a number of different templates. They said different things, they looked differently, they weren't very accessible always to all of the child protection actors, and perhaps they were somewhat more targeted towards international organizations rather than our national and local counterparts. So what we set out to do was to establish a global standard interagency template for an information sharing protocol that could be used between just 2 actors, and then new parties, new actors added to it over time. We recognize that in the onset of an emergency, often partnerships are still being signed. We're still figuring out who is doing what, who are going to be the case management actors, and what are our standard operating procedures. But right from the beginning, we want to agree, how do we safely, securely, and ethically share children's data, which is particularly sensitive in these settings. So we, again, got together, we got all the templates from all over the world, and we started discussing with our field colleagues. What works well? What doesn't work well? What do you understand? What do you not understand? What do you want to keep? What do you want to remove? And therefore, in these country consultations with a global interagency task team, we were able to hash out some templates, some outlines of what this would look like. Since then, we have been working with technical experts who have been fantastic, lawyers, data protection experts, information security experts, even indeed those that are involved in information technology, looking at the systems and the tools that we are using. Of course, some of our most valuable contributors have been child protection, case management specialists, and best interest procedure specialists at the global level. Our field colleagues have been invaluable in this process, telling us what they actually really need, and also that they need it now. So this is forthcoming. This tool is actually set to be coming out in the next month or so, with the accompanying guidance note. The data protection impact assessment, we are trying to dramatically shorten this. We recognize that in the onset of an emergency, it is taking too long. So what we are developing together in the same technical groups is a type of checklist that can be rapidly deployed to assess different tools, different systems, any risks that we need to mitigate, and a more comprehensive tool that you can use once things start to sort of settle down in your situation. Both of these tools can be used in protracted emergencies. In fact, we would highly recommend for many, many operations to revisit your information sharing protocol and see if there's any updates that need to be made. Next slide, please. Now, this one we are particularly proud of and particularly excited about. This is interoperability. This is getting two different information management systems to talk to each other. And those are Progress Child Protection Module. That's UNHCR's institutional cloud-based tool for refugee identity management, registration, as well as refugee protection case management, including resettlement, refugee status determination, voluntary repatriation, child protection, legal physical protection, and sexual and gender-based violence. We are connecting that tool to Primero's CPIMS Plus. We recognize that CPIMS Plus is being used widely globally. It is being used in a multitude of contexts, particularly where there are also refugees in these mixed settings and situations. We needed a way, instead of getting partners to have to use, or actors, child protection actors, government counterparts, to have to use two systems or have to pick between systems and have lengthy negotiation and much confusion, that we needed a way to get these two systems talking to each other. So it did take 10 years to agree, but as of 2020, we started developing the functionality. And now what we have is a digital bridge between the two systems, enabling them to understand each other and to transfer information in a safe, secure, and ethical manner, in a systematic and regular way that is initiated only with a child's informed consent and their assent, and on a need-to-know basis, strictly need-to-know. In fact, the fields of data that we share between the two systems to make a referral are already limited under data protection principles for necessity and minimization. So what we have here on the slide for you is just some of the key takeaways of really what was the point of doing this, and it really is to improve the experience of field workers. We want them to be able to share information from one system to the other rather than having to use two tools or more. We want to increase service delivery for the children that we aim to serve and their families, and we want to increase accountability. By using these digital information management systems, we are able to see who has performed what action when. We are able to track the implementation of child protection case management activities in line with best practice and minimum standards. So this project is really focusing around trying to address challenges around safely and securely transferring information. We don't want things on different pieces of paper, scanned, uploaded to the cloud, shared over email, WhatsApp, whatever it might be. We want this direct plug-in from system to system, and we built it. It's being piloted in Ethiopia and Gambela. Now, this has not been an easy ride. It's been a very challenging pilot, and we have learned a huge amount about how we implement this tool. And we also had amazing colleagues who were so willing from UNHCR and from the international NGOs, particularly Plan International in Gambela, have really supported us in testing this functionality endlessly to make sure that it is fit for purpose. What happens next? The pilot is going to be closing in the coming months. We foresee that happening in the second half of 2023, this year. And then we will start to roll it out to selected countries where we can see it being used on a much larger scale. And then we start developing our next functionality. For example, from having that referral functionality initially, the next thing is follow up, is feedback, is being able to walk through those steps of case management. For example, on a need-to-know basis, being able to share a best interest assessment or a best interest determination. But all of this is discussed and decided at the case management task force level, under the Alliance, and in the CPIMS Plus steering committee to get consensus and buy-in. We don't think that it's going to take another 10 years to agree. We think that we have the proof of concept There are still some improvements to be made, but we can't wait to release this widely. All three of these efforts really are about increasing accountability to the children and their families that we work for, that we work with and for, that we are doing things in the safest possible way, particularly when we are handling information often about the very worst thing that has happened to someone. So I wanted to show you very, very quickly what this referral functionality looks like, and then I'm going to hand back over to Laurent. Next slide, please. So you don't have to look at this in too much detail. We'll also share with you the links to the live demonstrations of how the functionality works. But really what this is about is sharing information from CPIMS Plus to Progress and from Progress to CPIMS Plus. I'll share those videos for you of what it looks like. Over to you, Laurent. Next slide, please.
Thank you very much, Jessica. So, colleagues, in terms of next steps, Jessica covered a lot already, but maybe good for all of us to keep in mind that the guidance note, the template for DPISP is just about to go out for endorsement with the Alliance, which will provide us with a tool that is widely agreed upon. The tool will then be used as early as July in the field in a number of selected countries that includes Moldova, Bangladesh, Turkey, and Uganda, and then we'll move on to a wider group of countries. With regard to interoperability, Jessica covered it. The pilot is about to be concluded, upon which this will be rolled out in selected countries, and then a plan will be designed between the Alliance, UNHCR, and UNICEF to roll this out. We didn't cover yet another product that is in the making and that relates to case management, best interest procedure, information management, and that is about data categorization. You know that one of the additional challenges we are facing when it comes to case management in humanitarian action is issues we have about how we define different data categories, subcategories, linking each data with a shared definition. So for the last more than a few months, I think for the last year at least, there has been some ongoing work led by Jessica, led by Marta, together with the Case Management Task Force around common standard definitions for the vulnerabilities children are exposed to, the incidents we want to address through case management, and the different categories of services we want to provide. We believe that having standard definitions, common understanding around those issues will help us not only simplify the reporting, but also the communication about the work we do, and provide us with a stronger framework to connect those data systems that Jessica was describing a minute ago. On that note, I'm going to pause because I think we still have a little bit of time for question and answers. You have on this slide Jessica's contact, as well as Marta Passerini, who works with me usually, could not attend exceptionally today, but very happy to support you and Jessica on any aspects of this work. So colleagues, over to you.
Thank you so much, Laurent. Thank you so much, Jessica, for that very, very interesting presentation about some of these things that are actually, I think, some of the real challenges in our sector. You know, as you said, you know, the challenges around data protection hit a lot of us very hard during the pandemic. You know, when we were confronted with that, with having to manage in an unprecedented context. We do have a couple minutes left. If anyone would like to ask a question, please feel free to pop it in the chat or to just take the mic. The floor is open if anyone has any questions for Jessica and Laurent.
If there is no immediate question, Kirsten, I would have wanted Jessica maybe to say a word about how do we go about factoring in national legislation and policy with respect to data sharing, data protection. I know this is an issue many colleagues struggle with or nervous about. So having her thinking about how to go about that would be super useful.
Okay, so I'll try to be brief, not my forte, but I'll do my very best. Please.
We have about a minute left, so
the fish, Kristen. So, colleagues, in the template that we have produced for the data protection and information sharing protocol, there are specific sections on national legislation and the whole regulatory framework in which you operate. So where we are implementing information sharing practices, data protection principles, yes, these are aligned to global and general data protection regulations and respective organizations' policies. However, with respect to the primary duty bearer, that is always the state. So if there is a national legal framework in place for information sharing around data protection, I'm just thinking off the top of my head, in South Africa, we have something called the POPI Act. We need to articulate that in the information sharing protocol. But what we've done is that we have made the protocol template that so much so you don't need to change anything. And there are tiny parts that you just need to change or add in specificities to your context. So it's no longer something that you need to renegotiate, that you need to rewrite, reinvent the wheel, but rather that you will include what is relevant on your national legislation so that it is aligned. Thank you.
Thank you so much, Jessica, and thank you, Laurent. And thank you to all of our speakers. So it is now over to me to draw this session to a close. It's been such a rich discussion. So many, again, looking at the question of accountability to children in humanitarian action from all of these different perspectives in terms of quality programming. What does it mean to reinforce accountability and to by delivering, coherent, integrated models that speak to each other. There was some great chat as well about how EQUIP and the MSP speak to each other. So I think this is really, it's been, at least for me, a huge learning experience. I hope for some of you as well. We've had some reactions from our colleagues in Iraq at the Participation Hub in Iraq. So thank you so much as well. We're so glad and pleased to see that this has been interesting for you all, and hopefully will be something that also you can take forward in your own practice. With that, again, thank you. I'd like to thank all of our participants from all of the different panels. And I would like to also just use this opportunity to say that we have another session on accountability coming up in 30 minutes time, which is actually about looking at how we can practice accountability to children in, also using participatory methodologies. And I will also be part of that session with some fantastic panelists from the CPMS working group, colleagues from Burkina Faso, also colleagues from the accountability sector as well, from other organizations working on accountability to affected populations in general, and thinking about how the collaborations, the multi-sectoral collaborations can take place to reinforce accountability to children for all humanitarian sectors, because that is what the centrality of children and their protection humanitarian action means for us all. With that, I pass over to Elspeth for the final closing remarks. Thank you.
Thank you so much. Thank you to the facilitators and speakers for this session. It's really incredible to see the rich variety of highly professionalized tools and collaborations. So thank you so much. So coming next, there will be a half-an-hour break now, but we do encourage you to go and visit some of the infographic discussions in the expo space. So please go there. The colleagues will be there who have developed their infographics and will be willing to speak to you about some of the initiatives that they are working on. So we really encourage you to go there. And then in 30 minutes time, there will be the accountability session, which Kristen has just flagged. There will also be a parallel session on how to do local advocacy for children associated with armed groups and armed forces, which will be taking place, which proves to be a very practical hands-on session where we will be designing our own advocacy strategies. So please do head there as well. And please do also take part in our closing poll. So if the producers can put this in the chat box, please do provide feedback on this session. It's really important for us as we continue to design our annual meetings and our sessions that we do get this feedback from you all. So thank you so much, and we will see you in the next sessions.
Thank you for a great facilitation as well from all of you, Kristen, Elspeth, and everyone.